I'm Jocelyn Maminta, live in the emergency department at Hartford Healthcare St. Vincent's Medical Center, here with Dr. Stephen Valassis. He is the chair of the emergency department here at St. Vincent's. And as many of us know, Dr. Valassis, ED visits have really dramatically dropped throughout the country at hospitals like this one, and still not at the level before COVID. We are in the waiting room. What was it like at the height of COVID?
So when the coronavirus pandemic began, the waiting room was not very different from this because a lot of patients were concerned about coming to the emergency department. And at that time, we were really seeing patients with COVID-19 or COVID-19 symptoms. At that time, we were able to get those patients directly bedded. So they would come into the emergency department. Before they even entered the doors of the emergency department proper, they were screened by nurses and techs, had vital signs done, had questions asked for risk factors, and these patients were put directly into rooms, cohorted away from any other patients. During the height of the pandemic, what we were seeing was mostly patients with coronavirus, but that slowly, thankfully, has decreased now. You know, at the height of the pandemic, we had almost 150 patients admitted to the hospital here at St. Vincent's. About a third of those patients were requiring ICU level care. And that has gone down slowly, as I think we've done a lot of good work in Connecticut and protecting ourselves and wearing masks and social distancing. And the report now is, it's 1, 2, 3 patients a day that are in the hospital, and the rest of the hospital is kind of getting back to business.
Fairfield region was extremely hard hit by COVID. To the right is the entrance to the emergency department. Outside at the height of COVID, you had a triage center set up.
So Hartford Healthcare worked very hard as we kind of started to see the spike in New York, and all the numbers from the prediction software we were about 2 weeks behind that. So we built out our triage area. So before patients, again, even walked into the emergency department, they were seen outside of the doors, kind of in a tented extension of our waiting room. And then everyone was masked, and then they were directly put into rooms so that they could be safe and so that patients who did not have the virus were not exposed.
We are really here to tell everybody how safe it is to come to emergency departments and how prepared we are. So how safe is it?
It's very safe. It's very safe. I think, emergency physicians, one of the concerns we have right now is that what you talked about at the beginning is that our volumes are not back where they used to be before the pandemic. So we're probably seeing close to 80% of the volume we were seeing before, but there's patients who are still having emergencies and they're not coming. And that's a concern for us because there's people who are having things like chest pain, things like neurologic symptoms, horrible headaches, and they're frightened to come to the emergency department. And really, we couldn't be in a better place right now in Connecticut. And again, like I said, the hospital only has 1 or 2 patients right now, and we're doing everything to keep everyone safe.
Absolutely. So let's give everybody a quick tour of what they can see when they come here.
Sure.
So let's walk through this way, and we are heading where, Doctor?
We're heading we're going to cut through and head into the main emergency department.
Okay. And here we go. And this is the area where most patients will be coming.
The area we're heading into is one of our 3 main treatment areas. We have 2 areas that are open 24 hours a day, and we have another area that is open during the busiest times of the day to take care of our volume.
Very good. And where are we headed now?
We're heading to an area of the emergency department called Zone C. Let me just get the door.
Okay.
We are blessed here with having a very large footprint in the emergency department. And having lots of rooms. And this department was built not too long ago, and as you can see, the rooms here are quite large. They're spacious. They all have doors on them that close, and these are all things that keep people safe.
When people come here, what should they expect?
So again, when people come in, they're going to be screened as soon as they come in. They're going to be asked questions looking for risk factors, both with symptoms and with travel. And then they're going to be triaged in a closed room. and then from there they're going to be directly bedded into one of our rooms. And again, we have certain treatment areas for patients who are either have concern for coronavirus or known coronavirus. Again, very few patients a day we're seeing like that. And then we have the rest of the emergency department that is separate from that, again, not to mix and to put anyone at risk.
That's right. So when should somebody come to the emergency department? We, of course, talked about a little bit of how patients with cardiac issues delayed their treatment, and some of them were impacted in serious ways.
So again, anecdotally, I can tell you that there were patients who did not come to the emergency department when they needed to, and their outcomes were worse. We saw increased out-of-hospital cardiac arrests, and some of these patients, had they come to the emergency department, they could have been treated, and that may have been prevented. The big concern right now is again, there's people who are calling and they're saying, I'm having chest pain, should I come in? And the answer is yes. I mean, we're here and we're safe. We're safe for our patients, we're safe for our staff, and there's a community that we take pride in taking care of.
Absolutely, and I wanted to also encourage all of you who are watching to send in questions, because Dr. Valassis is here. So if you have a question about your own safety when you come to the ED, he's here to answer them for you. A lot of people right now as well are concerned about heat stroke with the weather, the hot weather we are enduring right now, and maybe perhaps thinking that they can't come to the ED.
Again, like I said, I think it's important for people to know that we are very lucky and blessed to live in Connecticut. Our numbers in the community are very low, and we've taken great efforts to keep this emergency department and our other hospitals safe. So we're here to help people. I think someone else kind of put this, I think, well, if you think about what you come to the emergency department for before the pandemic, that's, I think, a good frame of mind. The COVID virus outbreak should not be what keeps you from coming to the emergency department. If you think that you need to come here and you're worried because you have chest pain, because you have neurologic symptoms, because you have abdominal pain, it is better and safer to come then, get treated, and have something taken care of, instead of something worse happening and having a worse outcome.
Now, we do have some questions from viewers right now. Sure. And the first one is from Luce from Facebook. Her question is, are patients arriving at the ER with possible COVID-19 symptoms diverted to a separate area from non-COVID patients?
Yes. So again, as patients come in, they're being screened by symptoms, and they're being screened by risk factors, so travel, being exposed to someone with the virus. And those patients are being directly bedded in areas where we're treating patients with coronavirus. They are not, and the other patients are going into separate rooms. So yes.
And this question from Gary from New Haven is, the question is, going to the ED means I will be paying a lot more, even with insurance. How do I decide whether I should go to the ED versus waiting to see my primary care doctor or going to a walk-in clinic?
I mean, I think the simple way to answer that question is that for things that are not emergencies, for superficial cuts, twisting your ankle, for things like that, absolutely using your urgent care or your primary care doctor is appropriate. But once you're having chest pain, you're having abdominal pain, you're having neurologic things, the things, again, that you would say, I should probably go to the emergency department, coronavirus should not be what keeps you from coming here.
And if there's a question in your mind, you should just come to the ED.
Absolutely. Better to be safe than sorry.
Susan from Westport wants to know, if my elderly father has chest pains, can I be sure he will not be exposed to COVID?
And again, so we're doing a lot as far as when people are coming in. Everyone is being masked. The staff is getting checked every day. The patients are being treated in separate areas. So it's as safe as it could be right now.
And we have one more question. Keith from Fairfield, he wants to know, if I have to go to the emergency department, is it safer to self-transport or call an ambulance?
So again, I think it depends on how you feel. In terms of the safety question, both are completely safe. EMS has been doing a tremendous amount of work through the coronavirus. They take a great deal of time in keeping the ambulances clean between patients, and that is very safe. If you think you need an ambulance because you feel unwell, you should call an ambulance. If not, you can come in. One way or the other is not going to expose you to coronavirus anymore.
A lot of people are concerned about another round of COVID. What can you say to them to make them feel that we are safe and that we are prepared?
So we've done a lot of good work in Connecticut, and I think we all need to kind of applaud the community for the work that they're doing. I think we need to just continue to be safe. We need to continue to mask. We need to continue to follow guidelines. We need to be smart in terms of where we go and travel and what we could bring back, to our families or to our community. Looking into the fall, people have a lot of concerns, and they're warranted. One of the hopes one of the big concerns is if we have coronavirus and a flu outbreak at the same time. And really, this simple mask may be the biggest thing that we can do to make sure that both the coronavirus spike doesn't come back and that the flu season is not as big. I think if we do simple hand washing, if we maintain distance, we wear masks, I think we should do well. And again, we've been through tough times here, and so if there's a second spike, we're prepared to take care of them.
As well as avoiding touching our face as well.
Touching your face is a big thing, and it's very difficult not to do it, as I think a lot of us have seen on TV and online.
Dr. Valassis, thanks so much. Great information here, and the message again is that we are safe and that we are prepared. I'm Jocelyn Maminta, live in the emergency department at Hartford Healthcare St. Vincent's Medical Center. Thank you all for watching.
Thank you.